Index, S. No. Content, 1. Prologue, 2. Background, 3. Concept of Ahara diet in Ayurveda, 2.1 Viruddha Ahara dietetic incompatibility, 4. Concept of Vihara lifestyle in Ayurveda, 3.1 Dinacharya daily regimen, 3.2 Rithacharya seasonal regimen, 3.3 Sadhavrita ethical regimen, rules of good conduct, 3.4 Dharniya and Adharniya Vega preventive regimens, 5. Preventive cardiology and overview, 6. Preventive therapeutic dietary and lifestyle measures as per Ayurveda, 7. Cardiac risk factors, preventive cardiology, 6.1 Preventive measures as per Ayurveda, 6.2 Madhumeha diabetes mellitus, 6.3 Ucharaktachapa hypertension, 6.4 Stalya obesity, 8. Diet chart for Vata Prakriti Purush, 9. Diet chart for Pitta Prakriti Purush, 10. Diet chart for Kapha Prakriti Purush, 11. References to 5-7. Ayurveda-based diet and lifestyle guidelines for prevention of cardiac disorders. 1. Background. The incidence of lifestyle diseases like hypertension, diabetes mellitus, dyslipidemia, and overweight, obesity associated with cardiovascular diseases is on the rise. Cardiovascular disorders continue to be the major cause of mortality, representing about 30% of all deaths worldwide. With rapid economic development and increasing urbanization of lifestyle in the past few decades, prevalence of these diseases has reached alarming proportions among Indians in the recent years, as Ayurveda is recognized as foremost life science and describes ways to prevent and manage lifestyle disorders. The world is being attracted towards its potential. Ayurveda provides effective solutions in the forms of dietary regulation, lifestyle advisory, detoxification and biopurification procedures like panchakarma, since it targets preventive, palliative, rejuvenative interventions and medicaments. The holistic approach of Ayurveda, treating the patient as a whole, meaning intervention targeted towards complete physical, psychological, and spiritual well-being, makes this science a wonderful option in lifestyle disorders. Basically, in Ayurveda, promotion of health and prevention of diseases is given more importance than the treatment of the diseases. Health and diseases is dependent on 3 factors: Ahara diet, Vihara lifestyle practices, and Aushadha drug and therapies. Among these, food Ahara is considered as most important one. Pathya is defined as the Ahara diet which is congenial to a person according to his constitution, appetite and digestive capacity of the body. Most health problems develop due to the wrong eating and improper cooking. The planning of diet, based on certain principles mentioned in Astaviti Vishasayatan, is very rational and scientific. Ayurveda emphasizes the characteristics of food in terms of quality, quantity and time, which vary with age, constitution, habitat, digestive power, season, disease, and also liking of the patient. One has to consume the diet which is suitable to him in all aspects, and deviation from these may cause diseases. In addition to these, wrong cooking procedures, irregular timing, and consuming imbalanced and non-congenial food and not following the prescribed rules for preparing, preserving and eating food may also cause imbalance of health. The proper intake of diet not only can prevent many health disorders, but also plays major role in the management of diseases. Therefore, due consideration should be given to all aspects of diet, planning for treatment of diseases and to maintain the health. According to Ayurveda, the Ayurvedic regime of healthy life is designed for achievement of a long, healthy, active life, providing relief from pain and disease, allowing enjoyment of life with attainment of satisfaction and contentment. Elaborate description is available on personal hygiene encompassing diet and regimen during daily routine, Dinacharya, seasonal routine, Ritucharya, and behavioral and ethical principles, Sadvrita. Observance of certain rules regarding suppressible and non-suppressible urges also paves way towards positive health. Cardiac risk factors can be prevented or managed by lifestyle, including principles of Dinacharya, Ritucharya, and Sadvrita. Point 2. Concept of Ahara diet. Any material in the universe, according to Ayurveda, is composed of 5 basic elements: the Pancha Mahabhutas, namely earth, Prithvi, water, Ap, fire, Teja, air, Vayu, and ether, Akasha, including human body and the food. Tridoshas, Vata, Pitta, and Kapha, which constitutes the body, is also made up of Panchamahabhutas. Vata is made up of Vayu and Akasha Mahabhuta. Pitta is made up of Agni and Yala Mahabhuta, and Kapha is made up of Yala and Prithvi Mahabhuta. Planning and indulging in the diet, balancing these elements maintain the homeostasis of the body. Each dietary item may have dosha aggravating, dosha pacifying or dosha balancing actions in the body. Specific diet has been mentioned in Ayurveda to maintain the balance of doshas disturbed due to various factors like season, age, etc. The food contains 6 basic tastes and each taste has predominance of particular elements of Pankamaha Buddha which exerts specific effect on the tridoshas and dhatus. The Madhura sweet rasa has predominance of Krithi and Op elements. Amla sour rasa has predominance of Krithi and Agni. Lavana salt rasa has predominance of Op and Agni. Katu pungent rasa has predominance of Agni and Vayu. Thikta bitter rasa has predominance of Vayu and Akash and Kashaya astringent rasa has predominance of Krithi and Vayu. It is mentioned that drugs having sweet, sour and salty taste alleviate Vata. Those having astringent, sweet and bitter tastes alleviate Pitta and those having astringent, pungent and bitter tastes alleviate Kapha dosha. In Ayurveda specific principles are described for consuming diet. It is not possible to derive the entire benefit out of food simply on the basis of quantity of intake, without considering the 8 factors like Prakriti qualitative characteristics of the food, Karana processing of food, Samyoga combination of food, Rashi the quantity of food, Desha habitat of the person, Kala time and seasonal variation, Upyoga samsta variable digestibility of various food articles and Upayokta the person who consumes the food. Fat-rich diet harms the body in the long run and very low-fat diet is also unhealthy in that it could result in fatty acid deficiency syndromes. Regular physical exercise, not heavy exercise, keeps the body healthy, both by suppressing appetite after a while and burning extra calories if needed. 2.1 Viradhara dietetic incompatibility. The food with incompatible or contradictory qualities has poisonous effect on the body that aggravates tridoshas in turn leading to various disorders viz. Gulma lump, allergies and skin diseases. It also destroys strength, vigor, memory, immunity etc. The dietary incompatibility is due to Desha climate, Kala season, Agni digestive power, Matra quantity, Satmya adaptability, customization, doshas tridosha, samskara mode of processing, Ahara virya potency of food, kosta bowel habits, avasta state of health, krama order of food intake, parahara restriction, upachara prescription, sanyoga combination, hridya delicious, sampad richness of quality and vidi rules of eating. Few contradictory combinations mentioned. In the classics are fish or its soup along with milk or milk products with alcoholic beverages, radish consumed with milk and lotus stem with honey etc. 3. Concept of Vihara lifestyle. The Dinacharya, Ritucharya and Sadvrita are parts of correct, ideal lifestyle measures mentioned in Ayurvedic classics for maintenance of health and also to achieve a long, healthy active life, providing relief from pain and disease. Detailed description of personal hygiene encompass diet and regimen during daily routine. Dinacharya, seasonal routine Ritucharya and behavioral. Rules of good conduct Sadvrita and description of suppressible Dharniya Vega and non-suppressible Adharniya Vega urges is available in Ayurveda. Abstain from those factors which cause mental agony. It is not what you eat that kills you. It is what eats you negative thoughts that kills you. Hipsley Cox J., Fielding K., and Pringle M. Depression as a risk factor for AHD in men. There are a host of scientific studies, both prospective and retrospective, that have shown a very close cause-effect relationship between negative thoughts like anger, pride, hostility, and depression and vascular diseases and, even, cancer. 3.1 Dinacharya daily regimen. It is advisable to wake up during Brahma Muhurta preferably between 4 o'clock a.m. to 5:30 a.m. One should attend the nature's calls. The soft brushes made out of twigs of Kadira, Karanya, Apamarga etc. should be used for brushing the teeth. Tongue should be cleaned by a long flexible strip of metal or plant twig. It not only cleanses the tongue but also stimulates digestion. Mouth should also be cleaned properly. Chewing of betel leaves with small pieces of areca nut Kadira and fragrant substances like cardamom, cloves, refreshes the mouth and enhances digestion. It is necessary to massage Abhyanga whole body with oil every day. Oil massage ensures softness and unctuousness of skin, free movement of joints and muscles, peripheral circulation and elimination of metabolic wastes. Regular exercise by Alma is essential for perfect health. It builds up stamina and resistance against disease, clears the channels of body shrotas and increases the blood circulation. It enhances efficiency of body organs, promotes appetite and digestion and prevents obesity. Whole body massage with dry powders of Yava, Kola and Kulatha Vartana every day. Bathing Snana improves enthusiasm, strength, sexual vigor, appetite, span of life and removes sweat and other impurities from the body. After bath one should wear clean clothes and smear the body with perfume. One should have regular shaving, haircut Kshora Karma, cutting of nails Nak Apkartana etc. 3.2 Rithacharya Seasonal Regimen. In Ayurvedic classics, there has been a thorough consideration for seasons, besides the dietetic regimens for days and nights. Whole year is divided into 6 seasons and detailed dietetic regimen for these seasons is prescribed. In spring season, bitter, hot and astringent diet is advised while salty, sour and sweet food should be avoided. Wheat, barley, honey syrup, fruits like mango, jackfruit etc. and meat of forest animals is advised. In summer season due to hot climate, aggravation of pitta occurs, hence pitta pacifying cold, liquid, sweet and oily diet is advised. Excessive hot, spicy, sour salty diet should be avoided. Intake of rice, milk, ghee, sugar, grapes, coconut water, meat of forest animals are advised. In rainy season aggravation of vata occurs, hence vata shamaka sweet, sour and salty food and drinks are preferred. The food should be hot, dry, fatty and easily digestible. Preserved rice, wheat, barley and mutton soups are advised. In pre-winter and winter season vata dosha aggravates due to cold, dry, chilly atmosphere in this season hence Vadana, Pittavardhaka diet is recommended. Hot, sweet, sour and salty food, milk, sugarcane, rice, oils and fats are advised and in autumn season aggravation of Pitta dosha occurs. Therefore, it is ideal to take ghee processed with bitter drugs, purgation, bloodletting, coolant, and light diet are advised. Diets dominant in bitter, sweet, pungent diets are advised ideal in this season. 3.3 Sadvrita Rules of Good Conduct. Ayurveda prescribes certain rules for maintaining healthy mind. These are principles of right conduct that are applicable to all people at all times and places. Practicing them gives balance and harmony to the mind. These are, whenever possible, devote your services to God, to the wise and to respectable or elderly individuals. Always speak the truth. Do not lose your temper under any circumstances. Do not get addicted to sensory pleasures. Do not harm anyone. As far as possible, do not expose yourself to hardships. Try to control your passions. Endeavor to speak pleasant and sweet words. Meditate every day for tranquility of mind. Observe cleanliness in all things. Be patient. Observe self-control. Try to distribute knowledge, good advice and help to others. Be straightforward and kind. Avoid irregularity in daily activities. Avoid overeating, overdrinking, too much sexual activity, too much or too little sleep. Behave according to the time and place where you are residing. Act always in a courteous and polite manner. Control your sense organs. Make a habit of doing all that is good and avoiding all that is bad. 3.4 Dharniya and Adharniya Vega Preventive Regimens. Observations of certain prescriptions and prohibitions given by Ayurveda ensure physical, mental and spiritual well-being. Non-suppressible urges. There are 13 natural urges, suppression of which leads to many diseases as given below. Suppression of urge for urination leads to difficulty in passing urine, urinary stone, atony of bladder and inflammation of urinary tract. Suppression of urge for passing stool leads to pain in abdomen, indigestion, gas in abdomen, headache. Suppression of flatus leads to pain in abdomen, indigestion, heart diseases, constipation or diarrhea. Suppression of ejaculation of semen may produce a stone spermatolith, pain in testis and difficulty in intercourse. Suppression of vomiting produces different types of diseases like urticaria, giddiness, anemia, hyperacidity, skin diseases and fever. Suppression of sneezing may produce rhinitis and chronic cold, headache, sinusitis and diseases of respiratory system. Suppression of irritation leads to hiccup, pain in chest, cough and loss of appetite. Suppression of yawning leads to diseases of the eyes, throat, ear and nose. Suppression of hunger and thirst may lead to nutritional disorders and debility. Suppression of tears leads to mental disorders, pain in chest, giddiness and digestive disorders. Suppression of respiration may cause suffocation, respiratory disorders, heart diseases and even death. Suppression of sleep causes the diseases like insomnia, mental disorders, digestive disorders and diseases of sense organs. Suppressible urges. One should suppress urges of greed, grief, fear, fury, pride, shamelessness, envy and excessive passion. Observe self-control and always speak truth. One should not harm others and should always act in a courteous and polite manner. Dietetic and behavioral bad habits should be given up and good things should be taken up, gradually. An intelligent person who seeks happiness should make a great effort to make good company and avoid the bad one. 4. Preventive cardiology and overview. More than 50% of the deaths and disability from heart disease and strokes, which together kill more than 12 million people each year, can be cut down by a combination of simple and cost-effective national efforts and individual attentions to reduce major risk factors. 80% of all CVD deaths worldwide occur in developing, low and middle-income countries. CVD has become one of the major leading causes of deaths in developing countries. It is estimated that 90% of CVD is preventable. Prevention of CVD involves improving risk factors through healthy eating, exercise, avoidance of tobacco smoke, and limiting alcohol intake. As per Ayurveda, the food consumed by an individual is transformed in the intestinal tract by the action of Kostagni, a digestive fire. Production of Aharasa, which is normal in quality and quantity, depends upon the normalcy of Kostagni. The rasa dhatu is the first dhatu which gets formed from the hara rasa, a nutrient portion of food after proper digestion of food, and is circulated by the action of Vayana Vayu throughout the body, providing nutrition to 7 dhatus, viz. Rasa, Rakta, Mamsa, Metas, Asti, Maya and Sukra. The organs and channels through which this rasa sambhana circulation takes place are collectively termed as Rasavaha Shrotas, and Hridaya along with the 10 Mula Dhamanis great vessels are considered as Mula main organ of the Shrotas. In contrast, if the quality and quantity of Ahara and or Kostagni are not in appropriate condition, it leads to improper digestion of food and subsequent formation of abnormal rasa dhatu, which has direct impact on Hridaya, the seat of Rasavaha Shrotas. In other words, the indiscretions followed by human beings in terms of Ahara diet and Vihara lifestyle can directly cause impairment of Agni and thus leads to formation of vitiated rasa dhatu. This vitiated rasa dhatu is not capable of performing its normal functions of providing proper nutrition to 7 dhatus in human body. According to Ayurveda, excessive consumption of food which is heavy to digest, dry, cold and with bitter or astringent qualities, excessive physical exertion, altered patterns of sleep including day sleep, forceful withholding of urges or initiation of urges, excessive indulgence in purgation, emesis or enema procedures, mental stress, excessive fear, overthinking, anxiety and indulgences in medications to counteract these things can be broadly classified into Avaraja, Viharaja and Manasika factors which in turn vitiate the Agni and subsequently the Rasa dhatu, the impaired Rasa dhatu in circulation. In presence of impaired Agni at the levels of Koshta and Dhatus and vitiated Vayana Vayu, eventually paves the way for metabolic disorders such as Metaroga, Stolya, Pramaha etc., which are milestones in the pathogenesis of Hridvikara. The common causative, predisposing factors for hridrogas as described in authoritative texts of Ayurveda are enumerated below so that these can be prevented for a healthy heart. 1. Excessive use of hot ushna, oily snigdha, spicy tikta and fried food items. 2. Excessive use of astringent kashaya rasa and irritant tikshna food items. 3. Use of incompatible diet viradhara. 4. Excessive physical exercise or lack of exercise. 5. Excessive stress, fear and anger. 6. Retention of natural urges at Harniya Vega. 7. Excessive fasting adhikarshan. 8. Overeating and irregular food habits. 9. Improper application of vasti and drastic purgatives. 10. Excessive consumption of alcohol, tobacco, cigarette etc. 11. Injury over chest Vaksha Pradesh.